Hi everyone, today we're diving deep into TIR, TAR, and TBR, three metrics every person with diabetes should understand. These aren't just numbers. They tell you how your blood sugar behaves minute by minute. TIR stands for time in range, the percentage of time your glucose stays within the target range, usually 70 to 180 milligrams per deciliter for most adults with diabetes. TAR is time above range, the percentage of time your blood sugar is above the target. TBR is time below range, the percentage of time your blood sugar drops below the target. While TIR gives a snapshot of stability, TAR and TBR reveal hidden risks. Today, we'll go beyond numbers to explore why these metrics vary from person to person and what you can actually do about them. TIR measures how long your glucose stays in the target range. A higher TIR usually correlates with fewer long-term complications, like heart, kidney, and nerve damage, but it must be considered alongside TBR and TAR. TIR is affected by insulin absorption variability. Even with the same dose, absorption can differ between days. It's affected by stress and hormones. Cortisol spikes can increase glucose unpredictably. Meal composition and timing also play a role. Fat, protein, and fiber slow glucose absorption and alter post-meal peaks. So if your TIR is lower than expected, it may not always indicate poor behavior. Sometimes your body's physiology is simply more variable. TAR tracks periods when blood glucose is above the target range. Frequent high glucose increases the risk of long-term complications. Causes of elevated TAR include overeating or carbohydrate spikes. Delayed insulin action or incorrect dosing can contribute. Physiological factors such as illness, infection, or hormones like glucagon and cortisol can also raise glucose. Lifestyle factors like sleep deprivation or irregular activity influence TAR as well. Even two people with the same HbA1c can have very different TAR patterns. One may have mostly stable glucose with brief spikes, the other may experience wide swings. TIR and TAR together reveal these differences, which HbA1c alone cannot show. TBR represents the time your blood sugar falls below the target, often defined as less than 70 milligrams per deciliter. Low blood sugar is dangerous and can cause dizziness, confusion, or even loss of consciousness. High TBR can occur even if someone follows their routine carefully. Causes include overcorrection with insulin or taking insulin without matching carbohydrate intake. Exercise timing is critical. Physical activity increases glucose uptake for hours. Delayed digestion can lead to insulin acting before glucose rises. Individual sensitivity varies. Some people's insulin or medications act more strongly. Some people have reduced liver glucose production during fasting, which can contribute to low glucose. High TBR is often invisible until a hypoglycemia episode occurs. That's why CGM is so valuable. It helps identify hidden hypo or hyperglycemia that fingerstick tests may miss. TIR, TAR, and TBR are connected, but not simply inversely. Increasing TIR does not automatically reduce TAR or TBR. They each have unique physiological drivers. For example, raising basal insulin might reduce TAR, but could increase TBR at night. Eating consistently can stabilize TIR, but may not prevent morning glucose spikes caused by the dawn phenomenon. Understanding why a metric is high or low is more important than simply trying to hit a number. To improve TIR safely, analyze patterns, not just numbers. Identify times of day with frequent highs or lows. Adjust therapy based on physiology, but always under the guidance of your healthcare provider. Consider lifestyle factors. Sleep, stress, and exercise timing all influence glucose. Use CGM alerts wisely. Early warnings can prevent both hypoglycemia and post-meal hyperglycemia. Even small improvements in TIR, along with targeted reductions in TAR and TBR, can significantly reduce complications and improve quality of life. Remember, TIR, TAR, and TBR are more than numbers. They reflect how your body responds to food, insulin, exercise, and stress. High TIR generally indicates stable glucose and lower long-term risk. High TAR shows increased risk of complications from persistent high glucose. High TBR indicates immediate danger, often hidden until symptoms appear. By understanding the causes behind each metric, you can make informed adjustments, not just chase targets. CGM provides a real-time window into your glucose patterns. Use it wisely to take effective control of your diabetes.